Hi everyone, I'm Herkulaas Combrink from the University of the Free State. I'm also part of the Data Science for Social Impact Research Group at the University of Pretoria, and I'm a medical scientist and a data scientist. Um, I will be talking today about, just touching base on some of the World Health Organizational public health guidelines for COVID-19 as they were introduced very early on in the pandemic, in the South African context, specifically before lockdown. Talk a little bit about public trust and public health, and then this idea of measuring public trust, how it's currently happening, and the approach we took just to augment what is currently there to get a little bit more perspective and deeper perspective on where we could have potentially gone wrong. Looking at COVID-19 lockdowns in South Africa, more or less the South African stance that was taken at a very high level, just so that you can orientate your mind around the type of analysis that was done. And then specifically looking at Google Trends analytics and mobility data that was released by Google and continuously is released by Google, how that works and how we use that data to augment and truly understand what is happening at a relatively granular level in the South African context. Share some of these findings and then go into a lesson that we learned in public trust and perhaps certain things to consider going forward. Now, in February 2020, last year, the World Health Organization published a very specific guidelines for, let me just hide this, very specific guidelines at a country level with regard to the 8 pillars of public health following that of influenza. And it's based around country level coordination and planning and risk communication. And there are other very important pillars, but the one that really encapsulates a complete and total buy-in as a reciprocal process between the government and official organizations and the public is risk communication and engagement, or RCCE. And so from the perspective of RCCE, at a very high level, it is very important that the public is always informed, in this case about COVID-19 as a guideline, what is being done and which actions are being taken. And the reason why this constant flow of information is important is one needs to continually optimize according to community feedback to detect and respond to concerns, rumors, misinformation, etc. So it's a continuous process. One also needs to develop community-based strategies based on community-based perspectives. As written in by the guidelines, very important that the contextualization according to different communities need to be taken into consideration when a particular mitigation strategy or whatever the case may be is introduced. And ultimately, the main reason for all of this is to be responsive during, in a very specific way, to be empathic, transparent, consistent in terms of risk communication so that it can build authority and trust. Very important that trust is sort of the core center theme of risk communication, especially if it is officialized. Now, there's a lot that has been written in this, so I'm literally just highlighting some of the things in the field. But what's important is this relationship between public trust and public health. Firstly, public engagement as a whole and as a concept is an iterative process, and it is important. It needs to be continuous, and it needs to follow a progression over time that is never ending for public lobbying, public trust, and also in the public health context. Multiple examples exist based on how influenza, for example, in terms of risk communication, should be handled, and how public trust can be built in that domain. Now, from the World Health Organization's guidelines, they did immediately from the onset say, please use the blueprint of influenza adapted for COVID in terms of risk communication strategies to build trust. And there's quite a large amount of literature on this, but people who do not have trust do not comply or really struggle to comply. The more public trust you have, the more compliance, the less public trust, the less compliance there are in certain things. And so you can in a very implicit way imagine that the less people comply, the less respect or trust they have in a particular system. And there could be a variety of other reasons as well. But it has been seen that if people in a general population do not have trust, then they generally do not comply. And a very important thing that has been written about quite a bit as well is this idea that if you want to build valuable trust from a public perspective, then valuable information needs to be shared. Now, valuable information in the sense of COVID initially could have been numbers, but as time went on, more detail and more sophisticated information needed to be shared as well. So just sharing a particular sequence of events or a particular sequence of numbers over a long period of time can get quite stagnant in terms of the information that the public is seeking. And if you don't continuously update that information or share that, that could also lead to some form of distrust. Now, public trust in a broad sense can be measured in three broad categories. There are a multitude of other ways in which one can measure public trust, but in a general sense, you've got your qualitative inquiry-based mechanism where there are surveys or questionnaires or a Q&A section, depends on which platform. And in the South African context, the Health System Research Council deals with a lot of the surveys with regard to things like public trust toward vaccine hesitancy or vaccine hesitancy amongst healthcare workers, etc. So there's a lot of work that has been done in this domain, and we know that in the South African context that there was trust diminished over time, unfortunately, in terms of the COVID-19 pandemic. Then we have narrative-based inquiries. So this could be specifically based around a discourse analysis of sorts, or uni or bilateral communication streams that are being observed and measured, etc. And again, Stats SA and the Health System Research Council, also the South African Medical Research Council, have done quite a bit of studies in this particular space. And again, have seen that there is a form of public trust and mistrust with regard to a very specific cohorts that they've investigated. But one interesting thing that we saw, and definitely something to be explored further, is behavior-centered observations, where you observe what people physically do and you observe patterns in their behavior, changes in the behavior, etc. over time at scale. And so to contextualize how COVID-19 lockdowns in terms of the South African context work, there were 5 primary lockdown levels in 2020, where your lockdown level 5, implied that there was a high COVID-19 spread and a low health systems readiness, and your alert level 1 indicated a low COVID-19 spread with a high health system readiness. And so, if you can see on the screen, the natural progression from March until the end of April last year in 2020, South Africa was in lockdown level 5, and then South Africa moved into lockdown level 4 the month of May. Then from June moving on to mid-August, it moved to lockdown level 3, September into lockdown level 2, and then toward most of the year, lockdown level 1, and then just before the Christmas period, went back up to an adjusted sort of lockdown level 3. So for the purpose of this entire talk and investigation, we're just going to look at the progression from lockdown level 5 down to lockdown level 1, and not the subsequent lockdown increases, decreases, etc. So we're just focusing on this particular bit. And what is also important to note is that throughout this process, that night vigils were not allowed, after funeral gatherings. So in the South African context, they call them after tears parties or gatherings, where people mourn and celebrate the life of those who passed. Nightclubs, land borders to a large extent remained closed, and there were restrictions on all of these, especially when it comes to attendance of sporting events, or public transport had very specific restrictions on it, and there were certain exclusions on education services as well. So throughout all of the lockdowns, these remain consistent. And again, you can imagine over this period of time that during lockdown level 5, there were far more restrictions placed in than lockdown level 4, 3, 2, and 1. And we're just going to unpack that a little bit. For everyone's perspective, in South Africa, we've got 9 different provinces. And demographically, they are a little bit different. The climates do differ vastly. But this is more or less the layout, with 2 landlocked countries in South Africa. Not going to talk about them now, but there's definitely a lot to be investigated in that perspective as well. And in the South African context, the population is roughly about 59 million people, and 64% of the South African population is between the ages of 16 to 64, with a median age of about 27. Now, there's an internet penetration rate in South Africa of between 46 and 62%. So there's more or less a total of about 36.54 million approximated internet users, with approximately 73% of them using mobile devices to access internet. I did highlight one of the a very important point with regard to the internet use and usage in South Africa, and that is that there is a digital divide in the South African context, and you still have a certain percentage of people that do not have access to cell phones and to digital technology. And so we're roughly talking about a 30 to 36 million people in this particular study, and not the entire South African population. And that is a very important point to make. But nevertheless, that is the sample population that we specifically worked with in this case. So what we did was we looked at two particular Google platforms that were available that shared data. And there was a bit of data manipulation involved in both, but to a large extent, the one was Google Trends. So Google Trends are when you physically go and log on to Google and you physically Google something. Google Trends do aggregate and de-identify the information according to the base station where you do the Google Trends from. I do know that there's a lot of people that make use of a VPN connection, and I can quantify that lot. And in South Africa, it's between 2 and 8%, which is very important to note because that was also in this particular sample as to be taken into consideration. So anyone with location settings that are available and anyone who Googled from a South African server, they were picked up by Google Trends and Google Mobility. But there are certain instances where it's not 100% perfect, and you will not get all of 100% of the population in this. Google Mobility, on the other hand, are aggregated from when someone has the location settings turned on from a geospatial perspective. So as someone moves through a particular park or a residential area or a retail area or a place that is labeled as entertainment or public transport or in transit or at a workplace or in a business district, whatever the case may be, however it was labeled on Google, Google will then capture that information and aggregate it. And they made the Google mobility data available into these 6 categories. And these two particular points of the platform were used to illustrate the point and to investigate this particular study. So what you're looking at on the screen are firstly a trend analysis of all 5 lockdown levels in South Africa. So during lockdown level 5, no one searched for lockdown level 5 whatsoever. It wasn't Googled. But during lockdown, toward the end of lockdown level 5, trends started coming up where people started looking at trends in lockdown level 4, lockdown level 4 for 3, 3 for 2, very little, 2 for 1. And then you can see towards the tail end of lockdown level 1, the trends going up where people started searching for lockdown level 3 again. As I've mentioned before, toward the end of last year, we moved back into an adjusted lockdown level 3, but we're not looking at that. What is important to note is that in the beginning of lockdown level 5, there was no inkling whatsoever where any of the trends around what lockdown level 5 was, how it was implemented, and how it was initiated was being searched for by people. People did not generally have this particular need to search for lockdown level 5 trends. And part of the assumption is that the official information that was announced in March about the lockdown level 5 from official sources at the nation address was sufficient enough for people not to distrust the information. But as the lockdown levels progressed, more people started searching for it. When we looked at the mobility data, we initially looked at it from all the provinces in South Africa. But what we ended up seeing is that there was a lot of noise. So we took the mean of it. In the paper and in future investigations, the granular detail for that will be there. But for this discussion, just going to use the mean of this because the trends are very similar across all the different provinces. So the first thing was that if we look at parks and the change of parks over time, you can see the sudden drop on lockdown level 5, where people physically did not go to parks, but during level 4, there was an increase, 3, 2, and level 1. Now, parks had a lot of restrictions put into place for what needed to happen, but it must be noted that parks only became available during lockdown level 3 to 1. And we could see an increase in people going to parks during lockdown level 4. There was a lot of things written about this, about the non-compliance that people had. going to parks, but a lot of it wasn't really enforced. It was just reported on. Same with public transport. During lockdown level 5, there was an absolute decrease. But during level 4, where public transport wasn't really as open and as well, you can see a sudden increase there. A lot of it was attributed to the livelihood of people, and one of the indirect effects economically of lockdowns, where a lot of people in South Africa rely on physically, working day by day and getting a salary day by day. And unfortunately, this is an indication that that was just the threshold where people needed to go to work, and a lot of people did report on similar findings. When we look at workplaces, so there was an obvious sudden decrease, but then it sort of stayed stable from lockdown 3 to lockdown level 1. And that is to a large extent that people were encouraged to work from home, and that's still one of the encouragements that's there. And to no surprise, residential and workplace lockdowns, residential movement increased during lockdown level 5. And there's obviously, one can see that they are directly proportional to one another. The more people work from home, the more they're going to be at home, which makes sense. But the one that was quite surprising and out of all of them, and to be unpacked a bit further, not necessarily now, is retail and recreation. During lockdown level 5, there was a sudden drop and in people's habits, and a lot of people sort of overbought and overstocked on food. And you can ascribe that increase that you see in lockdown level 4, that's more or less when the food ran out and people had to go back. But what is very interesting to note is that there was a trend upward increasing toward level 1, where both recreation and retail steadily kept increasing, despite all of the public communication to the behavioral and habitual changes that people needed to make. And there were lots written in this particular part, specifically about how people are non-complying. Even though nightclubbing is illegal, what ended up happening is pubs and restaurants ended up becoming impromptu nightclubs to a large extent. And there were a lot of people started getting very creative as well as business. And so to close all of this off, and just to look at what we had learned throughout this entire process, is that in February 2020, very clear and succinct guidelines were given out from the World Health Organization to the world to follow particular templates of how to respond to the pandemic as a guideline again, but as a point to start. And we specifically looked at risk communication and community engagement. And in the South African context, unfortunately, a lot of the granular level engagement that should have taken place did not. So at a national level, there was a continuous and consistent communication channel that was open to the public once every few months, or as something major had happened. But when you go to a provincial and local government level, there was a discrepancy in this. And so, South Africa did start really good when it came to their risk communication specifically, but the engagement there wasn't enough engagement through communities over time. This is not just in terms of the popular and public media, but also in terms of this iterative process that I spoke about from the start. And so South Africans lost trust, according to several studies, but we can observe the changes that took place of how people did. So the questions are like, at what point does public health become public infringement? To what extent should South Africa enforce policy implementation? Are strategies of risk communication effective at all if trust is lost? And should South African public healthcare specialists focus more on building public trust through the lens of risk communication? Thank you.